Okay. Hello, everyone. My name is Ashley Leonard. Also presenting with me is Sami. We are going to be presenting on athletes with diabetes. So this presentation will examine how diabetes affects athletic performance. We will review strategies for blood glucose management and outline key nutrition and exercise considerations for optimizing performance and reducing diabetes-related risks before, during, and after training.
Some special considerations. Glucose control can be challenging due to the complex interplay of insulin, physical activity, and stress. These are some of the special considerations we'll touch on during the presentation. Glucose regulation around exercise, hypoglycemia risk, hyperglycemia risk, insulin management, fueling and nutrition, hydration and electrolytes, recovery, and monitoring.
So some nutrition recommendations. So athletes, the more meals they eat per day will actually benefit them with their blood glucose regulation. So 5 to 6 meals daily or 3 meals consumed within the timing of their insulin. It will depend and it will vary with each person. You want to count the carbs for insulin adjustment. You want to favor low GI carbs before activity. Fiber stabilizes blood glucose. And then when it comes to fat, you want to eat 30 to 50% of your total caloric value. And then just just in general, you want to, or these nutrition recommendations will vary depending on the type of exercise practiced. And everybody is different, and each person will have to kind of learn what works best for them according to their blood glucose levels. But usually, nutrition recommendations with like macros and whatnot are generally the same with someone without diabetes. It's just the focus with someone who has diabetes is more based around timing of eating, the type of carbohydrate, and then controlling the blood glucose spikes and crashes. So when it comes to specific carb and protein intake recommendations, like I said, they are generally the same as somebody without diabetes. So pre-exercise, which is about 3 to 4 hours before, you want to have 1 to 4 grams of carb per kilogram of body weight, which totals about 15 grams of complex carbs before 15 to 30 minutes before training also when it gets closer to training. And then during exercising or training, for sessions that are 60 minutes, you want about 30 to 60 grams of carbs per hour. And you want these to be easily digestible sources like sports drinks and gels. And then for post exercise, it is 1 gram to 1.2 grams of carbs per kilogram of or within 30 minutes, as well as adding protein to restore these glycogen stores and muscle repair. So, with protein needs, like I said, it is similar to other athletes. It will range depending on the type of activity you are doing, but it typically is 1.2 to 2.0 grams per kilogram per day. So the differences with protein and carbs is more based on an hourly, and protein needs are mainly based on a daily.
So, some goals. So, the primary nutrition goals for athletes with diabetes are to maintain optimal blood glucose control while meeting the energy and nutrient demands of training. Nutrition strategies should support performance, recovery, and long-term health by balancing carbohydrate intake, insulin dosing, and exercise intensity to prevent hypo and hyperglycemia.
So when it comes to hydration needs, adequate hydration is important to maintain your blood volume and thermoregulation. Um, Athletes with diabetes do have an increased hydration needs due to greater fluid loss from high blood glucose levels. So you should begin your workout being very well hydrated, drinking regularly before, during, and after your activity. So dehydration can actually worsen hypoglycemia and impair heat dissipation and increase risk of ketoacidosis. Your fluid intake should replace your sweat losses and include electrolytes for longer sessions to prevent dehydration, maintain performance, and reduce risk of hypoglycemia and ketoacidosis. So high blood glucose leads to osmotic diuresis, which is fluid and electrolyte loss. So you should begin, like I said before, you should begin your exercise well hydrated with 5 to 7 milliliters per kilogram of body weight at least 4 hours before your activity.
Insulin management strategies. Insulin management for athletes with diabetes must be coordinated with exercise timing, intensity, and carbohydrate intake to prevent hypo or hyperglycemia. Aerobic exercise generally lowers blood glucose, requiring reductions in pre-exercise bolus insulin by 25 to 75%, or basal insulin by 20 to 50% for injections, or 50 to 80% for pumps, and added carbohydrate intake during prolonged activity. High intensity or anaerobic exercise may raise glucose, often needing little or no insulin reduction. Continuous glucose monitoring and temporary basal rate adjustments with insulin pumps are recommended for dynamic control, while post-exercise insulin doses should be reduced to avoid delayed hypoglycemia, particularly overnight. And hypoglycemia, athletes with type 1 are more at risk for hypoglycemia. And hypoglycemia is one of the most common and serious risks for athletes with diabetes, especially during and for several hours after aerobic or prolonged exercise, as muscle glucose uptake and insulin sensitivity remain elevated. Endurance and moderate intensity activities such as running, cycling, and swimming pose the greatest risk, while as well evening workouts and sessions performed close to an insulin dose can further increase susceptibility. And some of the symptoms of hypoglycemia are going to be shakiness, sweating and confusion. And during activity, I don't recall if I have this in another slide, but during activity, you want to aim for your blood glucose level to be between 100 and 180 milligrams per deciliter. And managing hypoglycemia. Managing hypoglycemia in athletes with diabetes requires proactive monitoring, insulin adjustment, and strategic carbohydrate intake before, during, and after exercise. Athletes are advised to check glucose frequently or use continuous glucose monitoring, reduce pre-exercise insulin doses, and consume, um, as Ashlee mentioned before, 15 to 30 grams of carbohydrate uh, if glucose levels are below target before starting activity. And then during prolonged exercise, additional carbohydrate of 15 to 30 grams every 30 to 60 minutes may be needed, while post-exercise snacks combining carbohydrate and protein help prevent delayed or overnight hypoglycemia. Individualized plans that balance insulin dosing, meal timing, and exercise intensity are key to minimizing hypoglycemia risk and maintaining performance. And um, endurance and moderate intensity aerobic activities, such as running, cycling, swimming. I mentioned this before. Those pose the highest risk of hypoglycemia for athletes with diabetes because they increase insulin sensitivity and muscle glucose uptake for several hours after exercise, like I mentioned previously. So prolonged or repeated training sessions, evening workouts, and activities performed within a few hours of an insulin dose further elevate the risk. And then let's see. And then also then on the other hand, there's also then hyperglycemia. And so that can uh, high intensity or anaerobic exercise may cause transient hyperglycemia rather than low blood sugar. So frequent glucose monitoring, insulin adjustments, and planned carbohydrate intake are essential for managing all of that. And also, hyperglycemia can be that's the surge. Let's see. Sorry, my notes. It has to do with the catecholamine surge, which refers to an increase in the release of catecholamine hormones, mainly epinephrine and norepinephrine, from the adrenal glands and sympathetic nerves in response to physical or emotional stress, such as intense exercise. And then during the surge, these hormones stimulate the fight or flight response, increasing heart rate, blood pressure, and energy availability by promoting glycogen breakdown in the liver and muscles and glucose release into the bloodstream. In athletes with diabetes, this hormonal response can cause a temporary rise in blood glucose levels. So that's exercise-induced hyperglycemia. So this is especially during high intensity or anaerobic activity, as mentioned previously, because insulin action is reduced while hepatic glucose output increases.
Okay, so closing recommendations for an athlete. So of course, continuing to monitor your glucose, coordinate insulin dosages with carb intake and activity level, and perform resistance exercises before aerobic for better glucose stability. So, in summary, athletes with diabetes can excel with individualized nutrition and glucose management. And then, with proper education and planning, athletes with diabetes can safely perform at their best. So, you just need to learn kind of your sweet spot with your carb intake and your glucose management. You also just have to kind of Also, keep an eye on your hydration, making sure that dehydration does not worsen your blood glucose control. Support recovery with your macros, which is your carbs, proteins, and fats. And then overall, just consistent monitoring, balanced macronutrient distribution, and coordination of meals with insulin are and activity are key to optimizing performance and diabetes control. So this is our references, and thank you very much.
You